Hello and welcome to episode 5 of the Fertility Frontier podcast with Her Helping Habit. That's where we discuss egg donation, surrogacy, infertility and a whole host of other subjects under that scope. And today we are joined by a very interesting guest indeed. So welcome, hello.
Hi, I'm Emma, and I am a donor coordinator at Her Helping Habit and a genetic counselor.
So my background is in genetics. I did my master's in genetic counseling. So I kind of come from the science side, and I also worked within IVF genetics.
So what exactly does a genetic counsellor do?
Yeah, so genetic counselors are basically trained both kind of the medical side of genetics and also the psychosocial counseling side of things. And the reason for that is that a genetic counselor is basically working with either individuals, families, or couples, and we're looking to assess potential risk of an inherited condition, so something that has a strong genetic link. And because unlike when you just get sick and get better, genetic conditions are lifelong. They can affect future kids that you might want to have. They can affect your family. There's a lot of important psychosocial aspects that people are dealing with. And so the counseling side comes into helping people navigate that, helping them to make decisions for themselves based on the genetic information they're receiving, and then also helping them to understand the more medical genetic science side of things. So having both that expertise on one side and the other, and using that to support people and help them in decision making.
Oh wow, that sounds like a really varied role. Like you're really getting to see the full spectrum of the subject, right from the scientific side and then all the way through to the engagement with actual people. That must be very interesting. So, can you explain what IVF is and how that relates to genetic counselling?
Yeah. So IVF, kind of at the most basic form, is basically doing human reproduction and fertilization, but outside the body. And so it's the combination of the egg and the sperm and creating an embryo, but instead of it happening naturally inside a body, it's happening in a petri dish in a lab. And there's a lot of reasons why someone might choose to do this, or a couple might choose to do this, fertility issues or things like that, but also something that we're now able to do because the fertilization is happening outside is that we can genetically test an embryo before it ever is implanted into a uterus. And so the reason why this has come about and it's important is, historically we've had ways of genetically testing a pregnancy, usually specifically done for people who might have a history of a really severe genetic condition in their family, something that they didn't want to pass on. And traditionally how that's done is, around 15 weeks into pregnancy, they can test for this and then choose to either continue on or terminate the pregnancy, which is obviously extremely difficult for people. It's something that you don't want to go through and can be really hard to make that decision at that point. And so IVF presents this opportunity to do that testing beforehand, before anyone is pregnant, and take away a lot of that anxiety and take away that decision making at a later time, and basically test embryos beforehand so that you know already that this embryo there'll be a way less reduced risk of passing on this condition.
So what inspired you to become a genetic counsellor?
Yeah, so I've always really loved science, especially like biology and genetics. I just found it super interesting. I kind of feel like genetics, I'm sure in the same way a chemist would be like, oh, everything boils down to atoms, but I'm kind of like everything boils down to DNA. Like it links every living being, whether it's a plant or an animal or a mushroom or anything. And so I think it's just like such a cool thing to learn about. And genetic counseling in particular I kind of stumbled upon it from one of my undergraduate university courses. We had a guest lecturer once come and talk about it. And it just seemed like such a small niche profession, but that married science and also working with people, and also has a huge emphasis on creating the most positive, supportive experience for people through what can be a really challenging time. And I think that isn't always stressed in all of medicine. You know, there's a big focus on the science side of it and like healing people, but that like in-depth support and understanding is not always emphasized as much. So I just felt like it was such a unique way of approaching things, and really married the science and people side of things. I mean, a lot of people in my program, we all kind of had a similar background where we were like, yeah, I was thinking about like research and science and just felt like something was missing.
Mm-hmm.
You know, working in a lab can be super isolating, and also I think the like rewarding nature of working in a lab or working in research is very long term. And so for some people that works a lot, but for other people, like I like working with people because every day you see the impacts of what you're doing. Whereas, you know, for me to wait 4 years to see my impact, I'm not quite patient enough for that.
So, how do you explain complex genetic information to patients and their families in a way that they can understand then?
Yeah, great question. I think for me, one of the most important things is first gauging, I guess, the level of understanding. Some people come in and, you know, they've had this genetic condition in their family forever and they know all about it and they're super studied or on all things DNA and genes. And then other people come in and maybe they had, you know, grade 9 science where DNA was brought up and that was kind of it and they weren't listening. So I think being able to listen to people and understand their level and then trying to adjust to meet that level. And then there's lots of, you know, tools and resources that you can use as a genetic counselor to make the information more accessible. So like one big thing that a lot of people use is visuals. So, you know, how can we visualize DNA? Like what does it look like? And how do we like visualize a gene? Like what does that mean? It sounds like we all know like gene, but like what does that actually mean? So a lot of like pictures and visuals. Most genetic counselors will also have an analogy that's their favorite go-to ever. So I really like DNA as like a toolbook, like a IKEA of how to build something, right? And you kind of look at like the instructions as all your DNA, and you look at like gene variants as the Swedish person who's typed this has made a typo, and now the instructions are wrong, so it's getting built differently, and it changes the function of the table that you're building. So everyone kind of has their own little analogies and ways of explaining it. And yeah, I think being able to find a different way to explain it to make it accessible, but also make sure that the information is getting there. Because again, you know, it's not just a one-time you're sick and you're better thing. It's really needing people to have a full understanding of what this is, because it might affect them in more ways than just the present. But yeah, using lots of those tools together can work on finding understanding. Oh, it's also important to be able to kind of gauge someone's understanding within your appointment or your session. So I might like to ask someone if they can explain it back to me in their own words. Not trying to make it sound too intense or too much pressure for anyone, but just as, you know, a friendly, open way to make sure that they are listening and understanding. I think also, especially when there's, you know, heavy information, people might just like clock out a bit, and so making sure that, you know, they are getting important bits and understanding, and then it also gives an opportunity to correct any misinformation before someone's walking away, especially if there's something that you know, they're thinking is going to be maybe be worse than it is, and trying to address that.
Mm-hmm. Yeah, well, that all makes perfect sense. So can you share a success story of a patient who underwent IVF with genetic testing?
Yeah. So the patients that I worked with specifically, just because I wasn't at the clinic at a long enough time to have gone, like, have any of my patients gone through all of the genetic testing all the way to pregnancy to birth, because that's probably a year and a half of time in minimum. But I think I've definitely seen, even in the beginning stages of the process, the positivity and the hope that there is, I think, that comes with, this process of genetic testing through IVF. Like, I can think of, there was this couple that came in, and they had 2 kids already, and 2 young boys. And when the oldest one was, I think he was like 6 or 7, he started getting really sick. And it took doctors and their medical team a really long time to figure out what's going on. And they learned that he had this really, like, extremely rare condition. I think it's like SOID, I believe. And it's basically an immunological condition that affects your immune system and causes kidney failure. And most kids don't live past age 10. And so eventually their oldest son, he passed away, I think when he was 8 or 9. And their second son, they learned also would have this condition, which is, again, super rare, and also a recessive condition, which means that both parents need to be carriers. So the odds of both of these parents being carriers for this extremely rare condition is so low. And then the odds of one of their kids having it would be 1 in 4. So the chances of both of their kids having it was just so low, but that's what they experienced. And this couple had been through so much, had lost a child, knew they were going to lose their other son, probably within a couple of years. And just meeting with them, I kind of knew their story, and it was just heartbreaking to hear, but they were so lovely and just, like, so hopeful and filled with a positive outlook for the future, because they had this opportunity presented to be able to grow their family without having to worry about this happening again. And they shared that they didn't have any regrets for what happened. Like, they loved the time that they had with their kids, but it's a really horrible thing for anyone to go through. And I think, even just them being with them while starting this process, you could just begin to understand how much of a positive and hopeful impact something like this technology has for people. Like, taking that weight off of them, that this isn't going to happen again. Yeah, it was really cool to be a part of. And also, like, they had a whole long diagnostic odyssey with the kids, and because the condition itself is so rare, I think the gene variant in the father hadn't even been found yet, so they had to go through the whole process of finding it. So it had taken years, and after years, finally, basically we were able to conclude that, okay, we can offer you this test now. If you want to go through IVF, we can do this for you. So it was pretty cool to get to witness that. And that was a couple years ago, so I actually wonder if they've had a kid now.
Yeah, that would be super interesting if you could find that out. So how do you help families cope with the impact of a genetic diagnosis?
Yeah, that's a great question. Yeah, so in general, I think this is, like, the hardest part of the job. It's delivering bad news and supporting people through that. And a lot of my personal reflections in school all kind of centered around this because I did feel like it was, the hardest part. And it's really interesting because there's actually like so much literature and research specifically on the idea of giving bad news and how do we support people through it. And so that's really where the counseling training, I think, comes in, that we learn as a genetic counselor. And so, we're trained to be able to use these skills that you would see in traditional clinical counseling, like, simple things like your nonverbal skills, like how do you make a room more approachable and feel safer for people? Like literally, how do you set up the furniture to make it feel safer? And how does body language affect how another person might be feeling, and how do you read that body language and interpret it? Things like using silence, and I think silence is a huge one. For me, if I've just had to give someone really difficult news to hear, like just allowing silence to happen if it needs to happen can be really important in giving someone the space they need to process. And also, like asking questions that are purposeful in helping someone to explore their feelings and making them feel like there is an open space to explore those, and learning how to respond in a way that's kind and empathetic, and all these kind of skills, these micro skills that all pull together to create a really supportive environment when there is that kind of life-altering, challenging news. Like for me also, I think there's an importance in sensitive directness and being honest with people about the information that they're being given, and not trying to overly sugarcoat things because you want to take care of someone. So being able to balance that honesty and truly telling people what's going on, but also being able to do it in a really sensitive way. And yeah, I don't know. I think the kind of beauty of genetic counseling is the heavy emphasis on that emotional support side. And while maybe not all medical professionals necessarily are trained to do that or have that emphasis, it's so important in genetic counseling.
Yeah, definitely. It sounds like such a unique role, quite dissimilar to a lot of other stuff. I think actually that is all we have time for today. But it has been absolutely wonderful and so illuminating to talk to you. I have learned a lot of stuff. Really, thank you again for coming in. You've been a wonderful guest. And hopefully we can get you back on the show soon. All right. Thank you for coming on. And thanks to our listeners for tuning in today. I hope you found this show as illuminating and eye-opening as I have. If you have any questions, concerns, anxieties, or just want to have a chat about any of the stuff on this show or any of our other episodes, you can find us at www.herhelpinghabit.com. On Instagram at Her Helping Habit. We're also on Facebook and Twitter as well. Thank you so much for joining us. We'll be back again soon. Bye-bye.